Hey there. Welcome to an exploration of something pretty unexpected, the connection between magnesium and addiction. Today we're going to explore some fascinating research that reveals a link we honestly didn't anticipate. Are you ready to have your mind open to new possibilities? Hi, I'm Dr. Harold Pierre, a board-certified anesthesiologist and addiction medicine specialist. With extensive experience in the operating room and in both methadone and Suboxone clinics, I've dedicated my career to helping patients overcome the challenges of addiction and recovery. I also specialize in hormone replacement therapy, working closely with individuals to restore balance and improve their overall well-being. While this podcast is designed to share valuable information, it's important to consult your doctor for personalized medical advice that fits your unique health needs. When we think of addiction, we often consider it as a struggle of willpower, but there's a lot happening beneath the surface at a cellular level. This is where magnesium comes into play. Now, when I mention magnesium, you might think of leg cramps, not necessarily heroin cravings, right? However, magnesium is absolutely essential for a healthy brain. It's actually the second most common positively charged particle inside our cells, making it crucial for keeping everything running smoothly. So, what does that mean? Imagine magnesium as a tiny battery in our brain cells. These charged particles, or cations, are how our cells communicate and function. Think of magnesium as the conductor of an orchestra, influencing how brain cells talk to each other through neurotransmitters. It even impacts those enzymes that control our brain chemistry and the gatekeepers managing the flow of information in and out of cells, known as ionic channels. But how does all this translate to something as complex as addiction? It turns out that magnesium can affect a surprisingly wide range of substances, including heroin, cocaine, nicotine, alcohol, and even caffeine. One of the key mechanisms is through dopamine, the feel-good chemical that often gets hijacked in addiction. Addictive substances crank up dopamine production, but magnesium can help regulate that release, bringing things back to a balanced level. It's like having a voice of reason when those cravings start whispering. Magnesium doesn't stop there. It's also a major player with another neurotransmitter called glutamate, which revs things up in the brain. Too much glutamate activity is linked to addiction, and magnesium steps in to fine-tune the system. It blocks glutamate from overstimulating the brain by occupying NMDA receptors, kind of like putting up a lot full sign at the parking spots for glutamate. Now let's move on to how magnesium can play a role in various addictions, starting with nicotine. Research shows that smokers given magnesium supplements actually smoked fewer cigarettes. This suggests a link between low magnesium levels and heavier smoking habits. Next, in the realm of opiates like heroin, studies reveal that individuals with heroin addiction often have lower magnesium levels, and supplements may help reduce relapse. When it comes to alcohol, it's a common addiction, and magnesium deficiency is prevalent among those struggling with it. Alcohol depletes magnesium levels, creating a vicious cycle of cravings. On a similar note, cocaine addiction is influenced by magnesium's role in regulating dopamine and potentially inhibiting certain enzymes like nitric oxide synthase, reducing the drug's rewarding effects. Stress and anxiety are also intertwined with magnesium and addiction. When we're stressed, our bodies release a hormone called corticotropin-releasing hormone, CRH, and magnesium can influence this process too. Stress can drain magnesium levels, making us more vulnerable to addiction. But magnesium has the potential to stimulate the brain's reward system, helping with anhedonia, the inability to feel pleasure, which can be a side effect of addiction. We've covered a lot today, from dopamine and glutamate to the protective role magnesium might play in the brain. It's clear that magnesium is involved in many aspects of addiction, acting as an unsung hero working behind the scenes. But remember, while today's conversation provides valuable insights, it's just one piece of the puzzle. It's essential to consult with a healthcare professional for advice tailored to your needs. The key to success is having open and honest conversations with your healthcare provider. Ask questions, share your concerns, and take an active role in your care. With the right guidance from a knowledgeable provider, it can also be a time of positive change and growth. If you choose to have that conversation with me, and you live in Oklahoma, Texas, South Carolina, or Florida, I'm here to support you directly with personalized care and expertise. If you're ready to take the next step, don't hesitate to reach out to me or my staff. Thanks for listening, and stay tuned as we continue exploring fascinating new topics together.